Most people with lower back pain stretch the wrong muscles, and that's why the pain keeps coming back, even when it feels better for a few hours. I'm going to walk you through 5 stretches that target the actual sources of lower back pain, not just the location where you feel it. These are the same movements we guide patients through when they come in frustrated that nothing else has worked. But before we get into them, it's important to understand why most stretching routines miss the mark. Why your lower back pain keeps coming back. Lower back pain is rarely caused by the lower back itself. In most cases, it's a compensation pattern. Your hips are too tight, your glutes aren't activating properly, or your hamstrings are pulling your pelvis out of alignment. Your lower back tries to make up for it, and that's where you feel the pain. So when you stretch your lower back directly, you might get temporary relief, but you're not addressing what's creating the tension in the first place. Here's what most people do wrong. First, they stretch only where it hurts. That gives short-term relief, but doesn't change the underlying mechanics. Second, they hold stretches for too long or push too hard, which can actually trigger a protective response in the muscle and make it tighten up more. Third, they skip the muscles that control pelvic position, particularly the hip flexors and glutes, which are often the real drivers of lower back strain. Let's go through the 5 stretches, and I'll explain what each one does and how to do it safely. Stretch 1. The kneeling hip flexor stretch. Your hip flexors run from the front of your hip to your lower spine. When they're tight, which happens after hours of sitting, they pull your pelvis forward and force your lower back into extension. That creates constant strain. To do this stretch, kneel on one knee with the other foot flat in front of you. Keep your torso upright. Gently tuck your pelvis under and shift your hips forward until you feel a stretch in the front of the hip on the kneeling side. Hold for 20 to 30 seconds. Don't bounce, and keep your core engaged. If you have knee pain, place a towel or cushion under your knee. This stretch is safe for most people, but if you feel sharp pain in your hip or groin, ease off. Stretch 2. The Figure 4 piriformis stretch. The piriformis is a small muscle deep in your glute that can compress the sciatic nerve when it's tight. This often shows up as lower back pain that radiates into the buttock or leg. Lie on your back, cross one ankle over the opposite knee, and gently pull the uncrossed leg toward your chest. You should feel a stretch deep in the glute of the crossed leg. Hold for 20 to 30 seconds on each side. If you feel tingling or numbness down your leg, stop. That means you're compressing the nerve, not stretching the muscle. This stretch is generally safe, but if you have hip instability or a labral tear, you may need to modify or skip it. Stretch 3. The standing hamstring stretch. Tight hamstrings pull the pelvis backward, which flattens the natural curve of your lower back and puts strain on the discs and facet joints. Place one foot on a low step or sturdy surface. Keep your legs straight, but not locked, and hinge forward at the hips, not the waist. The key is to tilt your pelvis forward slightly as you lean, rather than rounding your spine. You should feel the stretch in the back of your thigh, not your lower back. Hold for 20 to 30 seconds on each side. If you feel pain in your lower back during this stretch, you're going too far or rounding too much. If you have sciatica, be cautious. Overstretching the hamstring can aggravate nerve symptoms. Stretch 4. The cat-cow spinal mobilization. This isn't a static stretch. It's a movement that restores mobility to the segments of your spine that aren't moving well. When certain areas get stiff, others have to compensate, and that's often where pain shows up. Start on your hands and knees. Slowly arch your back, letting your belly drop and your head lift. That's cow. Then, round your spine, tucking your chin and pelvis. That's cat. Move slowly and smoothly between the two positions for 8 to 10 repetitions. This should feel gentle and controlled. If any part of the movement causes sharp pain, reduce your range of motion. If you have spinal stenosis or severe arthritis, check with your provider before doing this. Stretch 5. The child's pose with hip focus. This stretch decompresses the lower back while opening up the hips and glutes, which are often the hidden drivers of pain. Start on your hands and knees, then sit your hips back towards your heels and reach your arms forward. Let your forehead rest on the floor or a cushion. To target the hips more, walk your hands slightly to one side and hold for 20 to 30 seconds. Then switch sides. You should feel a gentle stretch through your lower back, hips, and glutes, not pain. If you have knee issues, place a rolled towel behind your knees. If you feel pinching in your hips or lower back, don't force it. If you're still watching, that tells me you're serious about understanding what's going on with your back, not just chasing quick fixes. That's the right approach. These stretches work because they address the mechanics, not just the symptoms. What you need to know about safety and results. You should feel a stretch, mild tension, sometimes a pull, but never sharp pain. If a stretch makes your pain worse during or immediately after, stop and don't repeat it. That's your body telling you something isn't right. Some muscle soreness the next day is normal, especially if you haven't been stretching regularly. But if your pain increases or spreads, that's a sign to pause and get evaluated. And if you have sciatica, numbness, weakness, or bowel and bladder changes, you should be evaluated by a provider before starting any stretching routine. As for results, most people notice some improvement within a few days to a week if they're consistent. But improvement doesn't mean the problem is solved. If your pain keeps coming back or you're not seeing progress after 2 weeks, that usually means there's a structural issue, a movement pattern that needs correction, or a diagnosis that hasn't been identified yet. Stretching helps, but it's not a replacement for evaluation when something more is going on. Your next step toward lasting relief. If you've tried these stretches and you're still dealing with recurring pain, or if you're just not sure what's causing it, the next step is clarity. That means imaging, a proper exam, and a second opinion if you've already been told there's nothing that can be done. You deserve to know what's actually happening in your spine and what your options are, not just what to try next. You can take control of this, but you have to start with the right information.